Good evening, dear viewers, and welcome to our program, Health Watch. Our topic tonight, dear viewers, is about stress and exams. As every one of you knows that, this is the time of the final exams, and most of our children, brothers who are facing exams, they have some kind of stress during this critical period. And in order, to pass the exams and feeling comfortable, really we need to know how to cope with these kind of stresses. Some people really experience that the stress exams are the worst situation that they face in their life, and in order to have a good and pleasant or reasonable experience with the exams, we need to know how to pass this period successfully. Our guest tonight is Dr. Abdullah Gholoum, the head of the psychiatry hospital. Tonight we're going to speak about how to cope, what we will expect from exams, and how to use simple advices that will help all the parents and our students. In the beginning, on your behalf, dear viewers, I would like to welcome Dr. Abdullah for being with us and thank him, for giving this valuable time, for our viewers. Welcome, Dr. Abdullah.
Thank you, Dr. Michal, and nice to be back here, and like to welcome all the viewers of KTV22.
Thank you, Dr. Abdullah. Dear viewers, if you have any questions regarding stress and exams during our show, don't hesitate. Now we're going to show for you our contact numbers, and we'll be very happy to answer your questions. Dear viewers, I would like to remind you that our topic tonight will be about stress exams or exam stress, and our guest tonight is Dr. Abdullah Gholoum, the head of the psychiatry hospital. And in the beginning, Dr. Abdullah, we would like to define, stress, or if we would like to know what are the psychological impacts of exams.
Okay. Well, we've been through exams many years of our lives as students and as physicians, and the main issue related to the exams is that there is the fear of the unknown. We don't know what to expect. We don't know what kind of questions will show up. So the basic reaction to this kind of situation is anxiety, fear and anxiety. And here I think it is worthwhile explaining the difference between fear and anxiety. Well, during the exam situations or during this examination period, anxiety is actually a normal reaction. Okay. And it is not like the abnormal anxiety that happens in other psychiatric disorders. So it is a reaction to a very real situation. There is this exam which has all the related uncertainties and, like I said, fear of the unknown. So there is anxiety related to it. It's a healthy anxiety because it can induce or stimulate the students to work hard, to do their best part in preparing for their exams.
Okay.
So in this situation, their anxiety is productive. It's not destructive.
And beneficial.
And beneficial. Okay. So this anxiety is normal during the exam period. However, if it goes beyond this kind of norm, when it starts producing negative effects, when there is use of extended times of studying, or use of maybe some kind of medications, or that becomes unhealthy. Okay. So the basic reaction or the of the exams is this anxiety related to that situation.
What about the fear?
Well, fear is a reaction to a known threat. or an existing
so
threat.
The threat is failing the exam. Can we consider that as a threat, or could be other threats?
Yeah, well, this is the basic result or the basic fear that that students worry about. You know, there is a famous saying in Arabic, and which we all know during our study days, but they're very difficult to translate in English. But basically what it says that on the day of the exam, you are either honored or humiliated.
Okay.
So there is this, you know, worry about not being able to pass, being, you know, failing, and then all the humiliation associated with it, and the disappointment. Okay. So that kind of produces that, you know,
that kind of
anxiety.
Anxiety.
Yeah.
Now, do people behave differently to exam stress? Do people react in different ways, or all the people will react
no.
similar better?
Different people react in a different way. And if you take the type of students that exist in any given class or in any given situation, you have your A student who has been studying ideally throughout the year. He knows his topics, but still he's, you know, worried about not getting the A.
Okay.
All right. That's his most worry. It's not about passing, because he knows he will pass, but he wants the A.
So the fear is not getting the A. Okay.
Now there is your middle range, you know, average students who, you know, in the B, C range, you know, or they are trying to work hard to get high grades, not necessarily the pass, and get high grades, not necessarily the A. They also have some anxiety, you know, for these exams.
Okay.
The other students who are the careless students who have no anxiety, they don't care about the exams because they know they are not going to make it.
Okay.
And they just, you know, are, you know, not putting the effort, not putting their input. So these are the students who have the least anxiety.
Because if they fail, this is, you know, expected, and there is no fear at all from that.
Yeah.
And if they pass, that will be a good news.
That will be good news.
Why do you have to worry about that?
News, yes.
Yeah.
So it depends on the student, depends on the expectation of each student.
So when we see that most of the people are B, C, and A, usually the failing or the people who may not complain from fear of exams is a minority, because now the majority still they will be anxious and they have some kind of fear.
Yeah.
Now, do people, you know, behave differently in a way that some people, they may have different symptoms than others, different behavior than others, do patients react like, you know, developing insomnia, for example, because of the stress? Some people, they may have different symptoms like palpitation. Do the people different in the symptomatology?
Yeah, it's how to cope with this stress, okay? And some students will, like I said, they will have some, you know, there are healthy ways and unhealthy ways. And I'm trying to shed light on some of the, you know, healthy ways of coping with the exam stress. As I always say in all my interviews, you know, you should eat well and sleep well, and that's the basic thing, you know, in any given situation, and particularly in the exams period. So studying for lengthy periods of time, not getting enough sleep, that's not healthy.
It's a very common behavior. It's very common thing that we see here in in Kuwait, that they will sleep late at night because they have exam tomorrow.
Yes.
It becomes like, you know, this is what looks like normal. You have to stay as much as you can studying till the last moment.
I know that happens, Dr. Mishal. However, it is not healthy.
It's not
because you might go to the exam the following day, you know, feeling exhausting, feeling fatigued, tired, difficulty concentrating, and these students might resort to drinking excess coffee or taking some, you know, kind of medicines or pills that might there are, you know, different kinds of pills that might make you alert and awake, and this is all unhealthy. The healthy way is to have a good night's sleep, you know, eat properly, And I see one of the points we may talk about, having rest times during your study time, because this is the way how you will, kind of cruise smoothly for your studies. Otherwise, you are putting too much stress on yourself, putting too much strain on your, even mental ability, and at the end you might lose what you are going for.
Now, when you talked about different methods, you mentioned something about the pills.
Yeah.
What kind of pills are you using?
There is this, like some people drink coffee, or some people take caffeine pills. These kind of...
We heard that about some tablets that are used by some long-distance drivers or transport drivers that keep you awake for more than one...
These are actually very dangerous drugs because they are addictive. And, they have addictive property, they have, they make...
And it is illegal.
It is illegal, of course. It is illegal. So I strongly advise anybody to stay away from, whether they are students or drivers, or to keep away from these, these medications or these pills, because of their dangerous effects.
Okay.
So they are to be avoided at all times.
Now, when we talk about taking enough sleep periods, do you recommend that they will do that at the day of the exam and even the days
all the
before?
Times.
All the time?
All the times.
Okay.
All the time.
That's very important. Okay. When we talk about studying, we tend to see different pattern of studying. Like, some people prefer to study alone, and some people, they gather around, to rehearsal and, discuss different topics together. Do you recommend, sometimes, if people have stress, to join a group and study together, or it doesn't matter?
There is no right answer to this question, Dr. Michal, because if we will get something out of tonight's maybe topic, is whatever works. Some students prefer to study alone. Some students like to study in the, there is a library, they go and read in the library. Some like to, like in a pair, a student and his friend, or a student and her friend.
Okay.
Some students like to study in a group setting, okay? And they're all feasible means of studying. It's whatever works for you. For me, for example, I can never study in a library. I get maybe distracted or something. I just need to be in my home, in my office, in my desk, where I have my stuff with me, and I like to sit. And I'm not the kind of also who kind of study in group. But during exams, it is acceptable to do some multiple choice questions in a group, because that enhances your knowledge and reinforces your information. However, for studying in particular, I myself like to study on my own,
so
or alone.
Let's say this individualized.
It is individualized. Okay. Whatever the students feel comfortable with, they can do it, and as long as they are getting the benefit of this method, whatever it is allowed.
So we can say, if it works for you, do it.
Yes, whatever works for you.
Okay. Now, when we talk about stress exam, do patients with special mental disorders or some, like depression, anxiety, do they have a problem, extra stress compared to the other healthy patients or healthy people?
The simple answer is yes. But in addition to depression and anxiety, any psychiatric disorder or any mental disorder that affects, concentration or sleep or motivation can have a negative effect on your ability to study and to concentrate. You mentioned anxiety, you mentioned depression, but also things like schizophrenia or bipolar disorder can make